here's what we've seen. Gastric bands, like any other procedure, fail. Sometimes it's a procedure that fails. Sometimes it's a patient that just doesn't get along with the band and find ways to cheat. The good thing about this is, in your case, you don't have too much restriction, which would mean that there's not a lot of over stress in the area where the band is and proximally. So what we do typically is, whenever we're going to do a revision surgery, the first thing we do is we want to release the pressure, so we let everything rest. The inflammation subsides, and then we can go in nicely and perform our procedure. What are we going to do? This is called a revision surgery because we're going to revise what you already have, which means remove the band and make your stomach pretty again, and then perform an additional different procedure, a different weight loss procedure. So for starters, the first thing we got to do is we got to go back in there and remove the band. Now we're going to tackle some adhesions and stuff like that, but what we're going to find typically when there's a band, we're also going to find some changes in the anatomy of the stomach and especially in the esophagus, depending on how much you relied on the procedure. Patients that over-rely on restriction end up having a hiatal hernia, where the stomach kind of starts creeping up into the chest. It starts expanding. The band is lower, and as you pour a lot of food into it and there's a lot of restriction, a band that's too tight, the stomach starts stretching and the upper pouch starts stretching. Those patients typically come in here with a lot of reflux symptoms, a lot of heartburn, a lot of food getting stuck, a lot of food coming back up during the evening hours, etc. Sometimes we find unstable bands, those bands that are tight in some mornings or certain parts of the day and loose at other times. In your case, it's totally loose. So what we're gonna do is we're gonna go in there, remove the band, remove all the adhesions around it, and then we're gonna remove the scar tissue that is created there, because when we remove the band, then we find scar tissue that we also have to remove. Now, once we do that, then we're going to look at the hiatus, which basically is the hiatal hernia, which means that we're going to see how much that stomach crept up into the chest, and we're going to pull it down. All right? So once we do all that, this is why this is a very technically demanding procedure that not a lot of surgeons offer. Why? Because it requires a lot of expertise. 20% of our patients come back from some other type of procedure and want a revision. Not our patients, they become our patients, they come from other centers in the US, everywhere else. So what we do is we remove the band, remove that capsule we were talking about, that fibrosis, that we make your stomach pretty again, pull everything back into place, and then we're gonna go ahead and do a sleeve. How do we do a sleeve? So we know for a fact that a revision surgery has a higher risk of leaks, and that you looked online and you saw that. So that's why we specialized on this, because we've had no leaks and we're not going to start with you. How do we do it? Well, first of all, we make your stomach just like God sent you, perfect again. That's the first step. Remove the band, remove that fibrosis, pull the stomach back to where it's supposed to be, fix the hiatus, and then we're going to go ahead and staple. We're going to use the newest stapling devices in the market, but that's not enough. So once we staple, we use the Ziploc technique. What's that? We oversew. What does it really mean? We bury that staple line and create a second seal. A second seal that makes that sleeve leak-proof. But here's the thing, what we learned over the years is that you depended on a band for weight loss originally. You want to depend on this procedure to some point, and you want it to last long. What we found out is that that second seal I performed, that over-suturing technique that we use here for many years, actually strengthens the sleeve and keeps it from expanding. So 8 months from now, you're still going to have the good, solid restriction.